Well, as the number of coronavirus cases continues to increase across the United States, a big challenge doctors could face is the lack of hospital beds and ventilators available. Local health officials say ignoring this could cause a deadly scenario. 3 News Now reporter Kent Lutzen has more on how the University of Nebraska Medical Center is preparing for this surge in patients. Kent?
That's right, Maya. Now with roughly 5,000 cases and counting in the United States, hospitals have limited time to prepare for what could be next. The University of Nebraska Medicine, although one of the top infectious disease hospitals in the country, is trying to find the space for critical coronavirus patients.
Things need to dramatically change, in the way that we provide care.
Shelley Sweethelm is the Executive Director of Emergency Management and Biopreparedness for Nebraska Medicine. She oversaw the operations and logistics during the Ebola outbreak in 2014 when UNMC treated American patients. Now she's doing the same, but for the COVID-19 pandemic.
You begin to look at numbers of 1 to 2% ICU requirements. That's a pretty big number at 1.9 million population. And then, you look at a fatality ratio of maybe 5%.
Nebraska health experts are predicting a wave of patients across the nation over the next 8 weeks. And Sweethelm says UNMC already works at 90% capacity, so hospital beds and other equipment will be stretched.
Ventilators are very rate limiting. There's not enough. There won't be enough.
It's not just Nebraska hospitals that are short hospital beds and ventilators. This seems to be a theme across the country as healthcare systems prepare for an influx of coronavirus patients.
According to the Organization for Economic Cooperation and Development, the U.S. has just 2.8 hospital beds per 1,000 people. Health experts predict the pandemic could cause between 10 million and 34 million hospital visits, and about a fifth of those patients will require intensive care.
Experts are having to choose between who gets a ventilator and who doesn't.
Yes.
Is that a worry of yours?
Yes. And again, it's going to depend on how great we do as a community and a state and how well we social distance to keep that all under control. But do we have a plan for all that? Yes.
Sweethelm added, just like hospitals, ambulances and other emergency responders will be overrun as well. Now keep in mind these hospital visits are on top of other admissions like heart attacks, strokes, and other trauma. So nurses and doctors, they're going to be busy as well as trying to keep from getting sick, Maya.
Yeah, definitely a big issue that could happen here. Now, Ken, what are some of the things that UNMC is doing to prepare for that influx and free open some of those hospital beds if needed?
Now, she says they are planning to reduce some of those surgeries and clinical appointments, even creating more ICU space by using other offices. Now, Sweethelm says this is why they want people to flatten the curve. I want you to take a look at this graphic. By doing things like determining if your symptoms require hospitalization, clinical care, or self-isolate. Now, self-isolate is the main thing that can help those hospitals avoid that red area, the surge, that would be pretty rough for our health field. In the newsroom, Kent Lutzen, 3 News Now. Back to you, Maya.